Go ahead, ma'am.
So, good afternoon, everyone. I'm Dr. Sayali. I'm the junior consultant and fertility specialist at Oasis Fertility Pune at the Karadi Center. So, I welcome you all for today's Facebook Live session, and we are going to talk about 5 important things while trying for pregnancy in today's session. So, as we all know, that if a woman wants to conceive, she needs to be healthy. Then only can this healthy woman deliver a baby which is healthy. So one of the most important thing when it comes to planning your pregnancy is your health. So you need to, do the lifestyle modifications. The woman needs to get healthy and she should, maintain an ideal weight. So in this, the addictions of any form, in the form of alcohol, smoking, or any drug abuse, all of this should be stopped. The woman should aim at eating right. Eating right in the sense is the dietary recommendations in the form of proteins, carbohydrates, and fat. This should be taken in the right amount. She should include fresh fruits, green leafy vegetables, whole grains, low fat dairy products in her diet. Ideally, she should, kind of curtail the intake of fast foods, any fried items, any junk food, aerated carbonated drinks, because these all things are just going to add in the extra calories, and these are kind of not going to have any nutritional impact on her health. Second thing is she should count her calories. She should, include all the right foods in the right amount, and she should have the adequate number of calories. Because as we all know, that if you want to maintain a healthy weight or if you want to lose some weight, calorie restriction is the main form. Calorie restrictions along with adequate exercise, can help you maintain that ideal weight. Second thing, as we said, is avoid excessive junk food, avoid foods that are not healthy. Next is the woman, should aim at maintaining a healthy weight. A healthy weight means if an individual who has a very low BMI, like if a BMI is less than 17 to 19, in these individuals also her menstrual cycles are not going to be regular. So in these individuals, there will be problem with the conception. So she should eat in the right amount. Individuals who are overweight or who are obese, they kind of have to, eat the right amount of food, have adequate exercise, and they have to kind of get their BMI in the normal range. Because as we know, that individuals who are obese, they do have, it's not that they do not conceive, but they do have issues with conception. Maybe the quality of the oocytes will be affected. The number of follicles which are selected in these individuals are of the lower value. Or even if they do conceive, then in these individuals, there can be complications in terms of increased risk of diabetes, hypertension. Even though the weight of the woman is on the higher side, she can deliver babies which are of low birth weight, or, there are increased chances of preterm delivery in these individuals. Therefore, if you want a healthy baby, you should be, healthy in terms of your, adequate weight. You should get yourself moving, have adequate exercise. So on an average, you should exercise at least 3 to 5 days in a week, and at least a 40 to 45 minutes of exercise. This can be in the form of gymming, or this can be, just they do a fast paced walking or slow jogging. This kind of helps in also controlling the BMI and increasing your basal metabolism. The next important thing while trying for pregnancy is to get a routine checkup. So, as we have said, that if you're planning for pregnancy, you should be sure that you are healthy. So, in the initial checkup, you need to know your hemoglobin levels. You have to screen, for any disorders, like if there's an increased risk of diabetes, increased risk of hypertension, any thyroid disorder. You have to screen yourself for any sexually transmitted disorders or any chronic diseases. So likewise, if the screening results come out to be positive, or if you're at increased risk, you can kind of modify your lifestyle or take the adequate medications to get all these conditions in control. If you're already a diabetic, if you're already a hypertensive, if you're already obese, or if you suffer from any chronic disorders, or if you have arthritis, you should visit the doctor and get all of these things in control. You should know what medications, for whichever condition is, suitable in pregnancy, and only those things need to be taken. Next comes is whenever you're planning a pregnancy, a doctor will not recommend over the counter medications for you. So you cannot take any medications if you're not well. You cannot just go to the pharmacy and purchase any medication and take it. So you should know which medications are allowed for the common ailments. And if you are in doubt, kindly, follow up with your doctor, and your doctor will guide you which is, healthy for the baby, which is not going to cause any risk in the baby, and which will be allowed for you in your pregnancy. The next thing is your prenatal vitamins. So you need to take a daily supplementation of folic acid in the dose of 400 microgram. Folic acid is known to prevent neural tube defects in the baby. This is going to prevent abnormalities in the baby. So if you're planning to conceive, you should at least start your folic acid supplementations at least 2 to 3 months prior. Your vitamin D should be supplemented. You should, take an adequate diet which is going to be rich in your iron supplements, going to be rich in your vitamin C and calcium. So iron is usually going to come from your green leafy vegetables. Vitamin C is going to come from your citrus fruits such as oranges, black currants, and calcium supplements are going to come from your dairy products, from your eggs and everything. So have a diet which is rich in all of these. If your hemoglobin levels are on the lower side, get yourself screened for why that is happening and get the hemoglobin levels in check. So you can take iron supplementation. So by the time you conceive, your HB values are going to be checked. Next important thing is when you're planning for conception is to get a basic fertility checkup. A fertility checkup, it involves the male as well as the female. Now for the male partner, we will have to do a semen analysis, and in the semen analysis we will come to know whether the count, the motility, and the normal forms of the sperms are in the adequate range. So if your semen analysis is in the normal range, then the chances that you can conceive by the natural method is on the higher side. If there is any abnormality in the analysis, we can give you antioxidants or we can give you some hormonal treatment to kind of upgrade that. And if that doesn't happen, or if the semen analysis is critically low, then in that case, you have to take some assistance for your fertility treatment. Next comes the fertility checkup for the female. Now, for the female, she needs to get a baseline scan done, and in the sonography, the uterus, the condition of the uterus, the inner lining, the 3D cavity assessment, then her AFC counts, that is a number of follicles that are present in both the ovaries, and her AMH, that is what is her egg reserve. If the egg reserve of the individual is in the normal range, and if all the other factors are okay, like if the uterus is good, there is no swelling, there are no fibroids or anything that is going to hamper your pregnancy, then it is a good enough chance that this female is going to conceive by the natural method. If there is any decline in the reserve, or if the reserve is critically low, so based on those parameters, she can go for fertility treatment, so that will also hasten the possibility of her conceiving. And second thing is it will make it possible for her to conceive with her own eggs. So a fertility checkup in the initial period will just let us know that, are you healthy enough? Do you have the reserve good enough, or the semen analysis good enough, so that you can try by the natural method? As you know, every cycle, there is only 4% chance of a couple conceiving. So if all the parameters are normal, we will usually recommend these individuals to go for a natural try for at least a 1 year period, because in this 1 year period, 60 to 70% of these couples are going to conceive. So definitely you need to give it the time, because the chance of conception every cycle is hardly going to be like 4%. But that is only in cases when your age is within the limited range, when all the parameters are normal. But when you're of an advanced age, that is when your age is greater than 35 years, then you can try for a natural period of 6 months. If you do not conceive, it's better to take some fertility help. Or if the parameters are compromised, like if your semen analysis is compromised, if your reserve is compromised, if your uterus is not good, or the lining is not developing well, then in this it's better to take assistance in the initial stages. Next important thing is, whenever you're trying to conceive, you should have intercourse at the right time, that is during the fertile period. So every couple should know what is the fertile period of the woman. So in this fertile period, if the couple tries to have natural contact, then it is the period when the maximum chances of pregnancy are there. So a normal menstrual cycle usually ranges from 21 to 35 days. So whichever is the longest cycle and whichever is the shortest cycle, you have to subtract a total of 14 days from it. And whatever the number comes, that in between the two numbers is going to be your fertile period. So the couple should at least have natural contact in unprotected natural contact at least on alternate days in this fertile period is there. So this is for individuals who have a normal menstrual cycle. So individuals whose menstrual cycle ranges from 21 to 35 days. But there are certain individuals who have PCO, or certain individuals who have a very poor ovarian reserve, whose menstrual cycles are very haphazard or very irregular. So in these individuals, you cannot, follow the fertile period method. So in this, if you are a PCO individuals, if your follicle is not developing at the right time, you need to go for ovulation induction. You need to go for the sonographic monitoring to know when your follicles are developing, when they are rupturing, so you can have natural contact and increase your chances of conception. Also, it is important to know that when you are, trying in your fertile period, you have to kind of, try to have intercourse in that duration. It is important that the couple is able to have an unprotected proper intercourse. So if the couple as a whole, like if the woman suffers from vaginismus, if she has painful intercourse, or if the male partner has some erectile dysfunction, or he's not able to keep proper contact, so in this case, the individuals need to get themselves evaluated so that they can take proper treatment. And if natural intercourse is not possible, then there are other methods by which we can assist them in their conception. Now, these are the important, things that we have seen in terms of trying to conceive. But one of the most important thing that comes later is, the mental health. The mental health of the couple as a whole should be stable. Now, they should be stress free. Now, the couple, has to try to maintain a cordial relationship. I mean, both of them, are in this fertility journey together. Now there are going to be several ups and downs. Not always a couple is going to conceive in the very first try. Not always this fertility journey is going to be that easy. Even if you conceive, there are going to be several ups and downs. So in this whole journey, you have to be together as a couple. You have to face whatever obstacles are there, because the ultimate aim of giving you the joy of parenthood, that does require some time. So you need to be mentally stable. You have to be patient in the entire journey, and you have to maintain a healthy cordial relationship. So you need to have the support of each other. So these are the very five important things that you need to know when you're trying for your pregnancy. So apart from that, as we say that pregnancy is going to be like a long journey. Sometimes it's like very easy for a couple. Sometimes a few obstacles are there for the other couples. So you have to be together. You have to take the right decisions. So if you're not able to conceive by the natural method, do go for fertility help. They are going to kind of assist you in your journey, and they're going to make this process a little more simpler for you. So I think that is all that I have for today's session. So let us see if you have any questions which are coming over from our viewers. Okay. So one question that is coming is, can watery sperm get a woman pregnant? Okay. So it's not about whether the sperm is watery or what is the quantity. Usually the fluid content in the sperm comes from secretions from your glands. So if this watery, ejaculate has adequate number of sperms in it, then definitely it is going to get the woman pregnant. It is not the content of the sperm or the quality of the sample that is there. If the sperms are of the right quantity, if the sperms are of the right quality, they are going to swim up, migrate up to the fallopian tubes and give you pregnancy. So definitely a watery sperm can get a woman pregnant. But we also need to evaluate that if the semen sample is less viscous, or if it is very watery, then we have to rule out certain conditions which can be inflammation or any other infections that can kind of even hamper the quality of the sperms. Okay, so the next question is, how do I physically prepare my body for pregnancy? So as we have already dealt in this session, you have to modify your lifestyle. You have to quit your addictions. No alcohol, no smoking, no drug abuse. You have to maintain a healthy body weight. Have the right amount and the right quality of the food. And in this way, you can prepare your body for pregnancy. Get your prenatal vitamins, get the prenatal supplements in the right amount. Okay, so the next question is, why am I not ovulating but having periods? So this usually happens in individuals who has a very poor ovarian reserve, or individuals who are PCOS. So in these individuals, the follicles are not going to reach the ovulatory stage. They are not going to grow at the adequate rate, and therefore the follicles are not going to rupture and release the eggs. So these individuals usually have irregular periods. But definitely some of the follicles that are growing are going to secrete some amount of estrogen that can kind of build up your lining, and the bleeding, the withdrawal bleeding is in that form. So therefore in these individuals you're not ovulating, you're not having your ovulation, but your periods are coming. Especially in individuals with PCO, there is something known as anovulatory cycles, where there is no ovulation but there are irregular periods which take happen after a prolonged duration. Okay, so the next question is, how do I know if I'm ovulating? So how do you know if you're ovulating? Is first is the few methods that we can use is increase in the basal body temperature. So their temperature kind of can be increased by around 0.5 degree Fahrenheit. Next is your consistency of the cervical mucus. So when you're ovulating, the cervical mucus becomes watery, it becomes less viscous, it increases in quantity so that it will allow the proper ascent of your sperms through these secretions. Next is you can use the LH kits, where LH surge will indicate that you're about to ovulate, or you can do a sonographic monitoring to know whether the ovulation is happening. Okay, so the next question is, what age is it best to get pregnant? So definitely the younger age group, that is when your age is less than 35 years. So any age around 28 to 32 years can be considered the best age to get pregnant. So your number of oocytes and the quality of oocytes is also of a good quality that way. Okay, so thank you everyone. I hope this session was informative and useful for all the couples who are trying to get pregnant, and all the best for your future journey. So I think this is all that we have from our side. If any help needed, you can dial the helpline number that is given below, or you can reach us physically at any of our two centers, that is Oasis Fertility, Arisa Avenue at Kharadi, or Kaspate Basti at Wakad. Thank you.